Theory and Practice of Counseling and Psychotherapy, 10th edition. Chapter 3, Ethical Issues in Counseling Practice. Introduction. Ethical principles and issues will be a basic part of professional practice. Balancing clients' needs against your own needs, ways of making good ethical decisions, educating clients about their rights, parameters of confidentiality, etc. Being an ethical practitioner is far more complex than a set of rules. Types of ethics. Mandatory ethics deal with the minimum level of professional practice. Aspirational ethics involves the highest standards of thinking and conduct. Positive ethics is an approach taken by practitioners who want to do their best for clients rather than simply meet minimum standards to stay out of trouble. Putting clients' needs before your own. Be aware of your own needs, areas of unfinished business, potential personal problems, and especially sources of countertransference. Professional relationship with clients exist for benefit. Examine your personal needs that can create growth-producing relationships. Ethical decision-making. Ethics are a fundamental component of effective counseling. They're guidelines that outline professional standards of behavior and responsible practice. Counselors must interpret and apply ethical principles to their decision-making. Codes do not make decisions for counselors. The principles that underlie our professional codes: benefit others, do no harm, respect others' autonomy, and are just, fair, and faithful. The following is the role of ethical codes. They educate us about responsibilities, are a basis for accountability and improving professional practice, and protect clients. The following are the steps in making ethical decisions. Identify the problem, look at the relevant ethics codes and laws, seek consultation, brainstorm various possible courses of action, list consequences, decide and document the reasons for your actions. To the degree it is possible, include the client in all phases of your ethical decision-making process. The right of informed consent. Providing clients with information they need to make informed choices. Educating clients about their rights and responsibilities. Empowering clients and building a trusting relationship with them. Addressing privacy issues with clients, including the implications of using technology to communicate. Some aspects of the informed consent process include the following: therapeutic procedures and goals, responsibilities of clients, limitations of and exceptions to confidentiality, legal and ethical parameters, qualifications and background of the practitioner, fees involved, approximate length of the therapeutic process. Dimensions of confidentiality. Confidentiality is essential but not absolute. Privileged communication is a legal concept that protects clients from having their confidential communication shared. Confidentiality is developing a trusting and productive client-therapist relationship. Ethical concerns with the use of technology. Confidentiality and privacy can become more complicated when technology is involved. The ACA Code of Ethics 2014 contains a new set of standards with regard to the use of technology, computer-mediated communication, and social media as a delivery platform. Exceptions to confidentiality and privileged communication. The client poses a danger to self or others. Clients who are children or minors, dependent adults, or older adults are victims of abuse. Client needs to be hospitalized. Information is made an issue in a court action. Client requests a release of records. Ethical issues from a multicultural perspective. Current theories can be and need to be expanded to include a multicultural perspective. Assumptions made about mental health, optimum human development, and the nature of effective treatment may have little relevance for some clients. Theories should incorporate an interactive person in the environment focus. Counselors must be mindful of diversity and social justice issues to practice ethically and effectively. A counselor or therapist should facilitate social action that leads to change within the client's community rather than merely increasing the individual's insight. An adequate theory of counseling does deal with the social and cultural factors of an individual's problems. Ethical issues in the assessment process. Assessment is an ongoing process designed to help the counselor evaluate key elements of a client's psychological functioning. It's influenced by a therapist's theoretical orientation, requires cultural sensitivity, can be helpful in treatment planning. Diagnosis is the process of identifying a pattern of symptoms that fit the criteria for a specific mental disorder defined in the DSM-5. It requires cultural sensitivity. Practitioners debate whether a diagnosis is necessary. It can be helpful in treatment planning. If used only for insurance purposes, can lead to ethical dilemmas. Ethical aspects of evidence-based practice, or EBP. Treatments have been validated by empirical research. Treatments are usually brief and standardized, or preferred by many insurance companies, enhance the effectiveness of client services, and to improve public health. Empirically analyze the most effective and efficient treatments. Mechanistic and do not take into full consideration the relational dimensions of the psychotherapy process and individual variability. Existential concerns that do not fit within a diagnostic category. Managing multiple relationships in counseling practice. Either sexual or non-sexual occur when clients assume roles sequentially with a client. Multiple relationship is often used instead of dual relationship because of the complexities involved. Non-professional relationships. Non-professional interactions or non-sexual multiple relationships pose a challenge to practitioners. Dual or multiple relationships are combining the roles of teacher and therapist or of supervisor and therapist. ACA Code of Ethics 2014 teaches how to manage multiple roles and responsibilities in an ethical way. Inherent in counseling relationships and training relationships, balancing boundary issues, addressing non-professional relationships. Boundaries in Psychotherapy, Ethical and Clinical Explorations by Zur, 2007, is an excellent resource. For helping professionals who are using social media, a host of ethical concerns about boundaries, dual relationships, confidentiality, and privacy are raised. Practitioners should maintain the following. Limit what is shared online. Include social networking policies as part of informed consent. Regularly update protective settings because privacy rules change. Becoming an ethical counselor. Knowing and following your profession's code of ethics. Interpreting the ethical guidelines of your professional organization and applying them to particular situations. Seeking consultation from trusted colleagues and supervisors. Ethical decision-making is an evolutionary process that requires you to be continually open and self-reflective.